Yes.
Thank you, sir. Governor Pritzker, I was struck by the certitude of your criticism of the administration's efforts. I was just looking on the Worldometer's website, and it appears to me that in terms of the experience measured by deaths per million during the pandemic, a number of nations have had worse experience than the United States. Of the larger ones, the United Kingdom, Spain, Italy, Sweden, and France have all suffered worse results. Do you believe that those nations also have had a failed response, national response?
Look, what I can tell you is that a lot of promises were made to the states, including to us, that were not delivered upon. And that's what I was really referring to. I'm not comparing us to other nations specifically. I'm just saying the federal government, the White House in particular, had made promises about the delivery of PPE, about testing supplies, had the capability to allow the CDC to give us more guidance, and really, very little of that was delivered.
One of the things that has gained a lot of currency, and the president refers to it a lot, is his early decision to cut off entries from China other than U.S. nationals. Do you concur? A lot of Democrats criticize that. Do you concur that the president made the right decision in that regard?
Well, I think we all are seeing now that travel by people who may be infected is something that everybody's paying attention to, and that limiting that by people who again come from areas that have significant infection rates is important. So I have not been somebody who's talked about that. What I have talked about, though, is the way in which that was done. We had a problem on the days in which the president just decided and announced it. Really, nothing was done to help airports deal with the problems of all the incoming international passengers from those places. Many people were desperate to get back to the United States who may have been U.S. citizens living in places like China or in Europe.
Thank you, Governor.
And so at O'Hare, just say we had an overrun of people. It was a real problem, packed into it.
Let me change subjects just a bit. You were particularly critical on the PPE thing, and you made reference to that again. I guess Illinois maintains a stockpile of PPE. Is that correct?
That's right. We had a stockpile to begin with.
Why didn't you have bigger stockpiles?
Well, look, I can't answer that question because those stockpiles were put in place before I became governor. But what I can say is, and I think I heard one of the other panelists talk about, that there were leftover stockpiles from H1N1 that had expired, that had to be, re-upped and allowed.
Suffice to say that if you had larger stockpiles, or any state had larger stockpiles of its own public health supplies, they might be less inclined to cast blame or find blame with the federal government for the amount of its stockpile. Fair to say?
Well, I would say this is certainly an unprecedented pandemic, but I would also say that the Defense Production Act wasn't really a criticism that we didn't have the stockpile at the federal level. It was that we could immediately have invoked the Defense Production Act in order to help us rebuild those stockpiles.
Well, let me ask you about that. So, I mean, what that would assume is that by taking command control of the economy for producing PPE, we would produce more and faster and get them distributed to the right place than leaving existing economic actors in place. Is that what you believe? And do you have any evidence to support that would have been better?
Well, the existing economic actors were not prioritizing PPE to the places that were needed in this pandemic. It was the states and local governments and emergency management personnel and health officials that knew
and hospitals
PPE needed,
right?
And hospitals too. And so my point is that we weren't getting that PPE from the federal government, and what we needed was we needed the federal government to organize the market to direct those resources so that we could use them to save lives.
What is to say that in the context of a 2-month period of time or 3-month period of time, the federal government taking over that market with a command and control structure would have produced more and in the right place than allowing the market to function, with augmentation of efforts from the federal government, such as FEMA directing resources as it did?
Well, look at
your confidence to that effect.
Right. Well, look at what happened with the air bridge. The distributors who received the items through the air bridge distributed them, again, not based upon where the need was, but based upon where their customers were, who they had as historic customers, not where the need was right at that moment. That's precisely what Defense Production Act invocation would have allowed the federal government to do, to direct the resources where they were needed. Remember, New York, California, other states that had an immediate rise in cases, PPE could have gone directly to those places immediately, to Chicago and to Illinois where we needed it. And of course, we knew where the hotspots were. So again, having some direction from the federal government would really have helped.
Thank you, Mr. Chairman. My time has expired and I yield.
Thank you very much. Chair recognizes